rise today to speak in emphatic support of the Appropriation Bill and the state budget handed down by Premier Marshall so recently, Marshall Liberal government's first state budget, and what a success it was. I described it in the local media in the electorate of Narungga as a gale of fresh air after 16 years of city-centric Labor governance, and that it is, with plenty in it for the regions, Mr Deputy Speaker, which makes being a regional MP a particularly enjoyable task at this very moment. Importantly too, it is a budget that makes the tough decisions that are necessary to ensure we return to living within our means, which is a concept that those opposite would only appreciate in some parallel universe, Mr Deputy Speaker. Similarly, it is a budget which delivers the promises that were made during the election, which is also very important to the state and its constituents, and gives them, the constituents, a feeling of living in a parallel universe of their own, Mr Deputy Speaker, because finally they've got a government that delivers and does what they said they were going to, and it is not a moment too soon either, Mr Deputy Speaker, a welcome sight for those living in South Australia. I was immensely pleased with the investments that were announced for the seat of Narungga during the budget and throughout the election campaign that were delivered, Mr Deputy Speaker, including the $88.5 million for the Port Wakefield overpass and 4-lane highway duplication, which is over and above what was promised during the campaign, and is an example of the Marshall Liberal government under-promising and over-delivering, providing the people of Port Wakefield and the people of the state at large exactly what they were asking for, and that is a safer crash corner and a more easy traffic flow through Port Wakefield to ensure that tourists get to their destination quicker, those visiting the wonderful Yorke Peninsula can get there quicker and safer, and enjoy more time and spend more tourism dollars where they are intended to, rather than spending too much time in their car or en route. So that was a wonderful announcement, an announcement that's been 30 years in the making, and I was pleased to be in Port Wakefield with the Deputy Prime Minister, the Premier and Member for Grey, Rowan Ramsey, to make that announcement relatively recently, much to the delight of local residents of Port Wakefield. Similarly, I was pleased to announce two special hospital funding initiatives that the Marshall Liberal government have provided: $720,000 for the Ardrossan Hospital to ensure continuance of vital accident and emergency services and palliative care and subacute care services, and as well as that, $605,000 for the Yorktown Hospital to upgrade surgical facilities and to employ more skilled staff. Other highlights, Mr Deputy Speaker, are the $12 million for additional chemotherapy services in regional areas, $150 million for a regional growth fund, $10 million to address the terrible situation that we find ourselves in with black spots in regional South Australia for mobile phone towers to go up to more money than to leverage more federal money to make sure we fix some of those proliferation of black spots around regional South Australia. We had a $315 million regional roads and infrastructure fund, a $20 million rural health workforce strategy, and $10 million for grassroots community sports clubs. And finally, in addition to that, Mr Deputy Speaker, there was $613 million in tax relief over 4 years, being reductions in the emergency services levy, payroll tax and land tax, which is money back in the pockets of normal South Australians who so desperately need it after 16 years of skyrocketing prices and costs. Having now been the member for Narungga for 6 months, I can confirm that the overriding concerns of the constituents that I have come through my office in Maitland are regarding health services, costs of living and roads. So the investments in the Narungga electorate and the policies actioned to deliver reductions in taxes and levies have been very well received indeed. They've gone over overwhelmingly well with the people I have had the pleasure of interacting with since the budget was handed down on 5 September. I've spoken in this place before about the importance of the Port Wakefield traffic solution that has waited for 30 years and was finally delivered in the 2018-19 budget. A genuine state-building project which wasn't of any interest to members opposite who, due to electoral imperatives of the previous Premier, who only prioritised projects in marginal seats and pork barrelling situations, and thus had no interest in investing in the seat of Narungga. So we're well pleased to make sure that that announcement, almost $90 million, was sent our way, and I thank the Minister for Transport and Infrastructure for being agreeable to that request. Mr Marshall himself, the Premier, visited Port Wakefield and Crash Corner last week on 9th of September and could hear firsthand from the residents about how well the plans have been received and the general optimism about the securing the future of Port Wakefield as a town and ensuring that it continues to offer the great services it does for people travelling through that town on their way to the YP, EP or further west or north. A wonderful project indeed. A meeting with RAA representatives last week also cemented the overpass project as a welcome inclusion in the budget and one that will offer increased safety and traffic flow going forward. Aside from the significant investments in Yorktown and Ardrossan hospitals, the measures in the budget to re-establish regional health boards are equally as important. $6.8 million over 4 years to establish local health network governing boards, including 6 boards in country South Australia that will put decision-making closer to the people who deliver and receive healthcare. At a recent meeting with the Friends of Yorktown Hospital, they expressed particular upset about not knowing where their hard-earned fundraising monies had gone under the previous government. They had raised approximately $20,000 or so of hard work making sauces, holding barbecues, accepting huge donations from a town op shop, knowing full well what specific resources hospital staff were lacking, but having no ability to request funds to be used for those specific needs. By re-establishing the regional health boards, this decision-making will be returned to the local communities with which the decision affects. The previous government, as if they were operating in some sort of parallel universe themselves, thought that the centralisation of health would achieve better outcomes. But predictably, transforming health all just managed to transform health to a disaster. Yorktown and Ardrossan are great examples of the negligence shown by the previous government, and those opposite have no credibility to question this government as we get to work fixing their mess in the health sector. Yorktown and Ardrossan are also good examples of this new government beginning to fix that mess. I also particularly welcome the $20 million for the Rural Health Workforce Strategy, which aims to address a shortage of health practitioners in country areas. We can have all the services in the world placed in country areas, but we can't deliver anything without the staff that are trained for the job, and they are in dire need and drastic shortage. So it's pleasing to see that being addressed in this budget. That is being addressed by increasing rural interns in support of pathways for rural generalists and GPs, and is just one measure in the pipeline to address the drastic shortage of doctors and nursing staff in country towns. I'm lucky to be involved in the Wallaroo Service Planning Steering Group, looking at framework for identifying and evaluating potential future service options. And staff retainment and recruitment is a huge issue as we work together to ensure that Wallaroo Hospital can meet projected demand on its services. There is current significant concerns around the Wallaroo Hospital, with Moonta Medical Centre and the Wallaroo Owen Terrace practice already withdrawing its doctors from the hospital roster, which in the last 2 years has placed considerable individual stress on doctors at the Katina Medical Associates, and they can't possibly be expected to continue to run 24/7, and it costs a lot of money to secure locums in regional areas. Other valuable and vital health initiatives in the budget include the $45 million to reduce elective surgery and colonoscopy waiting lists in public hospitals, $16 million to increase palliative care support, $2.5 million for additional suicide prevention services. I'd like to take this opportunity to note the wonderful contribution of the local SOS, the Stamp Out Suicide networks that we have operating in Narunga. I've talked previously about their contribution, but I was lucky recently to attend a viewing of The Ripple Effect with the Honourable John Dawkins from The Other Place, put on by the Yorks SOS group, which is a wonderful initiative, and it certainly educated me and the approximately 100 or so people in the room about the troubles faced by people that are suffering from this terrible ailment, and I look forward to continuing to support them as they continue to offer that vital volunteer service in our electorate. There was $4 million for more domestic violence accommodation beds, $1 million for the Healthy Towns initiative to encourage rural and remote communities to come up with creative ways to improve local health, which is another good scheme implemented by this new government. And finally, Mr Deputy Speaker, the $140 million over 10 years to address backlog maintenance in country hospitals, the $140 million which will go a long way to sort of restoring the backlog that had been built up over the past 16 years by the government, who did not have the electoral imperatives to invest in regional hospitals and ensure that they would continue to be up to a standard which was satisfactory for surgical services and the like. I look forward to seeing that money be spent where it is most needed and advocating strongly for some of it to make its way to Wallaroo. I've heard so much about cuts in rural public health services under the previous Labor government, including from local doctors lamenting the role of country hospitals having been diminished by stealth, threatening the economic viability of rural doctors and, by extension, service delivery to patients. So many public forums, filled town halls and petitions with thousands of signatures fell on deaf ears. The loss of surgical services at Yorktown in 2017 was a huge blow to the residents of the southern York Peninsula community. The reasoning was that too few procedures were being done to ensure safety standards are met. And why weren't they being done? Because the operating theatre was not properly being maintained and the money was not being spent to ensure that it had the proper facilities and equipment. Air conditioning maintenance was cut, no sterilisers replaced, money locally raised and held in Adelaide not allowed to be used on staff, and health advisory boards silent so it would not get out that decisions being made, such as at Yorktown, were not about reduced demand or not having the skilled, willing staff there to provide the services. It was about unwillingness from the city to not allocate the money that they needed there to properly maintain facilities. A shame, Mr Deputy Speaker, that that was the decision made by the previous government. How absurd it was to stop 300 surgery procedures at Yorktown and transfer them to the already overstretched, bursting at the seams Wallaroo Hospital, a 2-hour drive away along one of the worst roads in the state. At a Corn town meeting attended by hundreds of people and 8 HAC regions, 7 council regions and reps from some 40 country hospitals around the state, so much was spoken of erosion of services, sustainability of health services and GP practices, consistent and constant battles for communities by HACs and GPs, with hierarchy wasting everyone's time and resources. The Kingston community was mentioned as having had to use a $900,000 donation from a community member to replace its hospital roof. Such was the reluctance of Country Health SA and the other bureaucracy to front the money to fund the replacement of the hospital roof. One would have thought having a roof on your hospital, Mr Deputy Speaker, would have been considered a vital need. But no, it had to rely on a donation of a private community member to replace the roof. They thought of Waikerie resorting using bequests to keep its operating theatre open because the state government failed to pay $140,000 for a new air conditioner indoors. Cummins, as you would well know, Mr Deputy Speaker, couldn't replace its blood fridge. Boolaroo Centre was without essential anaesthetist machinery, and Mudonna, with its closest X-ray machine, 250 kilometres away. This budget puts respect for country areas back into the equation, and not a moment too soon. How disingenuous to insist services will be continued only where it is safe to do so, and then to deny essential maintenance required to keep facilities up to standard. Thankfully, Premier Marshall visited Ardrossan Hospital with me on 9 September and felt firsthand the great relief from Director of Nursing Jodie Luke to be delivered, which will come from the delivery of the $720,000 over 4 years in this budget to cover its accident and emergency services and to deliver additional palliative and hospice care and provide more staff training. The Ardrossan Hospital, which is a wonderful community-owned hospital run exclusively on private contributions and donations from the public, lost its state government funding in 2011 and has been in constant financial strain ever since, with the public accident and emergency service costing the local community about $200,000 per year to run. It's wonderful to see that funding returned, Mr Deputy Speaker, and I look forward to continuing to work with the Ardrossan Hospital going forward to make sure they've got a continued stream of funding. With regard to sport funding, I must mention the $10 million over 2 years for grassroots community sports clubs with a focus on female and family-friendly infrastructure to build on the success of the recent sport and rec funding within the Narungga electorate. We were lucky enough to receive, through the Active Club grants, Mr Deputy Speaker, $20,000 for the Atherton Basketball Club, $25,000 for the Kabowie Tennis Club for the Save the Tennis Club program, which was in response to the savaging of its finances by Cocaine Cassie, $5,000 for the Curramulka Bowls equipment, $20,000 for Curramulka Community Club to upgrade its courts, and another $5,000 for equipment, $3,500 for the Kadina Basketball Club and $3,000 for Port Wakefield Bowls Club, as well as $20,000 to upgrade lighting at the Wallaroo Oval with an aim to make it suitable for night games in the future, and $3,500 for equipment at the Wallaroo Golf Club. We were able to double the value of the sports vouchers to assist families to pay their subs to make sure that their kids can have an active and healthy lifestyle. Registration fees and buy uniforms, so they could pay their registration fees and buy uniforms for their kids to play sport, which is another important feature of this wonderful success of a budget. Playing sport in rural areas is important for health and social benefits, providing participants with a connection to the town that they represent. Hopefully we get a few good footballers come through Kadina as a result of this initiative. Thus, I also welcome the $30 million allocated for the $100 sports vouchers that under the previous government were $50 vouchers, which didn't go far, given subs for junior sport can be as much as $200 per child. In support of the volunteers who do so much in rural communities, providing services that would otherwise be out of reach for many, I welcome the $5 million in the budget to make free of charge volunteer screening checks. From 1 January next year, community service volunteers, and rightly so, will not have to pay the $59.40 fee for the screening checks they need to serve their community. The government will cover this cost, so that this will be very, very welcome to many who should not be left out of pocket to perform the good deeds that they do without payment. There is much to be done, but this budget is a good start for Narungga, and importantly, we've delivered on every one of our pre-election commitments. So it is with great pride and that I commend this bill to the House and look forward to continuing the great work that this Marshall Liberal government has started and set with this platform going forward.
Member for Wright.
Thank you, Mr Deputy Speaker, and I too rise to speak to this appropriation bill.